let's talk about schizophrenia spectrum and psychotic disorders and the impact on client factors and occupational performance. So as you can imagine, occupational functioning varies greatly in people with schizophrenia and other psychotic disorders. And not only that, but schizophrenia and the medications used to treat it cause a variety of disruptions in daily functioning. The majority of individuals who experience significant long-term occupational performance impairments, some of them live in a state of recovery without these impairments, but the majority of them, individuals do experience these significant long-term impairments. So most often, recovery involves learning to manage symptoms while engaging in meaningful life activities, as opposed to full remission of all symptoms. So going back to, the majority of these individuals, unfortunately, have significant long-term impairments, and then a smaller amount who are able to manage those symptoms. Timing of the illness onset typically is late adolescence, early adulthood, and this is a time when individuals are developing the skills needed for independent living, and they're expanding their life roles. So the onset of the illness can really impact the achievement of these important developmental milestones and tasks. People with schizophrenia also encounter significant stigma, which also can contribute to decreased quality of life. For example, people with schizophrenia are often believed to be violent, but a diagnosis of schizophrenia alone is only weakly associated with any sort of violent behaviors. In contrast, people with schizophrenia are at high risk to be the victims of violence, which is, really something to think about. That they're not the perpetrators of the violence, but they're the victims of the violence. Studies have found that people with schizophrenia report lower levels of life satisfaction and happiness as compared to those without schizophrenia. So we really also want to think about their wellness, their health, wellness, and well-being. So really just thinking about the medications to address the schizophrenia and other psychotic disorders, the actual condition of schizophrenia, spectrum and psychotic disorders, and then how are they impacting occupational performance. So for example, ADLs, the ability to care for one's own body can be impacted. Cognitive deficits and disorganization can impact the ability to attend, sequence, problem solve, self-care tasks such as grooming and dressing, and can often result in ineffective, incomplete, or unsafe self-care practices. Initiation of self-care activities may also be impacted by avolition and anhedonia that is often present in schizophrenia. And as we talked about with some of the other mental health conditions, side effects of medications may decrease interest or ability to engage in sexual activity. When we think about IADLs, the impact of schizophrenia is often most evident in decreased ability to engage in IADLs effectively. Many people with schizophrenia require support to adequately and safely perform home management and financial management for independent living. So these services or this assistance might be provided by a community mental health service provider. It might be family and friends. But, if you're thinking about the impact of the actual schizophrenia on maybe when we talk about social participation and relationships, there might be a disconnect with family and friends. There might be a disconnect with community resources. So maybe those activities are not actually getting done. Those IADLs are not actually getting done. Cognitive deficits and disorganization can also greatly contribute to their ability to engage in IADLs and can also be a concern for safety. As you can imagine, health management is a huge area of concern. Individuals with schizophrenia are often challenged to develop, manage, and maintain health and wellness routines. So for us, we can teach illness management techniques that has been shown to be a very effective treatment approach to improve functional outcomes for these individuals. So that might be, something to consider when you're developing your treatment plans. Rest and sleep. A majority of people with schizophrenia report sleep disturbances. Side effects of medication can also cause sleep disturbances. And then education, work, leisure, social participation, all of those are impacted based on cognitive functioning, ability to engage. If you're thinking about the IADL impact of limited ability to manage finances, and then maybe not able to hold down work, how all of those together can impact maybe their ability to be housed, stay with family. So it's a wide-reaching condition that has wide-reaching effects. So if you have any questions, don't hesitate to reach out.